Hello, my name is Mercedez Hinchcliff, and I'm the current president of ausEE and also an academic at the University of Wollongong. Thank you very much for allowing me to explain and explore our current research on health-related quality of life for those using home enteral nutrition in Australia and New Zealand. As we know, HEN is a critical nutritional support method for individuals who cannot meet their dietary needs through oral intake alone. By focusing on health-related quality of life, we're not just looking at the physical health of the users, but also on how their treatments impact their overall well-being and their daily life, as well as social life. This study is particularly vital because it helps us understand the lived experiences of both adult users and the carers of pediatric users. The insights we'll go through in the next few slides leads us to better targeted support and interventions, ultimately improving the quality of life for all involved. Thanks for listening.
For the study, we did a questionnaire and we used our patient networks and partners to help distribute the questionnaire through patient groups in Australia and New Zealand. We were lucky enough to have 155 total responses, with the skew a little bit towards female adults more than male, but also 85 carers of pediatric users, and that was a little bit more of an even split. Throughout this, I will be speaking about the split in the female and the male responses, comparative also with the pediatric versus the adult users. So overall, our research really was categorized into social participation, work or school life, psychological well-being, and physical functioning. So some of those questions that we asked respondents to think about was really their health and physical well-being. So our questions assessed whether tube feeding improved health, improved nourishment, and potentially weight management as well. We also looked at daily functioning, evaluating how tube feeding affects your agility, your ability to perform daily nuanced tasks, and maintain normal meal routines and structures within your family or just daily life at work or through socialization. We also asked a little bit about your perceived nourishment or ability to monitor your nutritional intake. The food preferences was interesting too, because we wanted to find out whether or not users could still enjoy aspects of food, including texture, smell, temperature, or anything else outside of tube feeding. When we spoke about some emotional and psychological experiences, we were really probing for questions with mental health in terms of if there were questions or increased anxiety, depression, or concerns about body image and potential health-related worries. There were also some adaptation fears that we wanted to find out about. And we were gauging about concerns about long-term dependence of tube feeding and potentially missing that traditional eating experience, such as savoring food, chewing, and swallowing. Additionally, we asked about social and lifestyle effects. We asked about social participation and the ability or lack thereof to engage in social activities, travel, and potentially maintain social relationships. For the adults, we asked about their work support. We wanted to know if the workplace helped support the ability to manage tube feeding in a working environment. For the pediatric population, we were really looking at school support and if the school had the ability as well to manage feeding tube in a school environment. We also brought up a little bit about social and in thinking about social exclusion or inclusion. Did we find there were feelings about isolation or exclusion, or the opposite? Did people feel included? And the efforts, did people try to hide their tube feeding tube feeding from their friends and their workplaces. These were all asked, and we'll have some interesting results coming up. One of our preliminary questions was looking at the conditions associated with the feeding tube. We were careful in the wording of this because we wanted to make sure to not capture all the comorbidities that the patients may have, but rather what was the condition that led to the insertion of the feeding tube. So in this is quite interesting. The largest one, the largest condition that was found was the dysphagia or swallowing difficulties, followed very closely by the poor growth and failure to thrive, reflux, gastroparesis, EOE, motility issues, eating disorders, malabsorption, and you can see, and the other category is quite large because all of those were small in the number of responses. But I do think it's really important to notice here that the swallowing difficulties and poor growth and failure to thrive were really sitting at the top of our list. We did have some really great news that was really apparent from the results. Speaking closely with the adults here, the majority of adults reported really an enhanced sense of health, meaning that they felt better every day. They wanted to get out of bed. They felt that energy come to them again, and they really felt well nourished because of the tube. Now, I think this is really important because the reason why someone gets a tube and looking at the slide before was failure. One of the biggest reasons was failure to thrive, right? So if we look at that and we look at the results here, they're saying the majority actually did feel better, did feel well nourished, then at least what we are hoping that the tube would achieve is having the results that we intended to use it for. So this is some really great news that came out of this study. So some of our findings with the social life were really different between the pediatric users and the adult users. Adults were actually significantly more likely to avoid social activities solely due to the tube feeding, whereas the adults or the carers who responded for their pediatric users said that they didn't really notice that huge increase in social isolation. So I think here that it's quite clear that that carers most likely protect and make sure that their vulnerable patients or people that they're caring for are looked after and are included socially. Sometimes as adults, we don't do the same thing for ourselves. So I think that there is a real need here to encourage education and support with adult users to make sure that they feel welcome and that they feel that they have the autonomy to speak to their peers about their tubes. In the research too, they said that it wasn't really just about the eating part, but it was more about like that social meaning behind food. And they were also really concerned about the visual or the visibility of the equipment that they had on them, either through a nasal gastric tube or feeding tube accessories. So interestingly enough, though, that although pediatric users did not feel isolated at all from their peers, their carers did, again, pointing to that most vulnerable population being the adult users. So this was a surprise finding, I think, for us. So the adults were the ones that were reporting that they were hiding their feeding tubes and had body image concerns, didn't want to speak about it with their friends or their workplace, and definitely had that feeling of social isolation. So for pediatric users, there was good news. They felt, or the carers of pediatric users felt, that the schools really supported them in terms of having a good, safe place to feed and support via the administration of the schools, etc. So this was a really positive finding for our pediatric users. Men also reported support in the workforce as well, with finding adequate space and support from their immediate supervisors in terms of tube feeding. The one population that did not feel supported in this area were females. Females did report a lack of support by their immediate supervisor and their overall organization in terms of finding places to feed or overall support over tube feeding. So it's interesting that we found such a gender difference with support in workplaces. And I think that that's something that we really need to investigate a little bit further as well, because adults are likely to feed at work and it is a necessity. So we must really dig a little bit deeper and to find out why women are feeling that sense of lack of support in the workplace. Financial stress was also linked to work limitation, especially in the adult participants. So we'll talk about financial stress in the next couple slides, but the added stress of having to feed, knowing you have to feed, and potentially not being supported at work is definitely another stress to the respondents of this survey. So there is an overall psychological burden that was really identified in the research. It actually was as one of the most affected areas for users, particularly in adults. And I've spoken a little bit about this with the social, but even though tube feeding is a physical intervention, the emotional and identity related consequences were really substantial. So I'll walk through some of those now. So for anxiety and depression, a large proportion of adults reported experiencing anxiety and or depression relating to their tube feeding specifically, not necessarily to what they had, their diagnoses that led them, but the tube feeding itself or the tube itself. There wasn't a significantly different response between adults and pediatrics statistically, but the severity and context really differed because adults often linked their anxiety to long-term dependence and uncertainty around what their health might be in the future and around social stigma. So that differed a little bit because the pediatric users showed lower reported rates, most likely because we've got that buffer, right? The buffer of the emotional stressors being that carer. The next is the worry about the health and the adaptation. So I think adults were significantly more worried about their bodies being able to adapt to the tube feeding and whether or not their bodies would ever, quote unquote, go back to normal or they be able to eat as normal again. So that worry really fueled that anxiety for those adult patients. The adult patients also really reported more general health related worry, concerns about potential complications, infections, repeat visits at the hospital, long-term outcomes, and feeling a loss of control over their own body. Next is the loss of the eating experience. So this came through loud and clear as one of the strongest psychological findings, because this really identifies that emotional impact of losing that ability to be able to chew and savor food. This intersects with the social well-being that we spoke about in the last slide as well, because not only are people missing socializing, but they are also missing the aspect of just chewing and savoring food. Female participants in particular reported a greater distress about this loss. And I think that's really married with that social aspect as well. So you can really see that come through in the female side. Body image concerns, again, female adult participants were more likely to report that body image was a major concern relating to their feeding tube. Men, although reported image concerns, there was a statistical difference between the two. Those for women especially, it included the worries about the visibility of the tube, social stigma, and how potentially others might perceive them and their tube. And I think that when we looked at the data, it was showing us that in more so than their male counterparts, females were trying to hide their tube and avoiding social situations where they thought if people could see the tube or equipment with it. So the identity and social stigma as well, and again, these are very intersecting. Many adults describe that the feeding tube as something that made them feel different. It made them feel different to their peers or their relatives or work peers as well. So in that sense, it also contributed to that, the anxiety, certain avoidance behaviors, and that reduced social participation. And I spoke about this again, but that's the carers' psychological impacts were largely seen here. The carers of those pediatric users experienced a lot of psychological burden and strain, especially about they themselves, even though not tube users, but caring for somebody with a tube, how they had social isolation and emotional fatigue. In the results in front of you, these did span against pediatric and adult patients, except for the heightened concern about health. But in terms of skin irritation, the majority of patients did find skin irritation because of their tube. Also, more than half had disrupted sleep. Now, some reported that they slept better because of feeling more well-nourished, but because of the discomfort that actually hindered their ability to have an undisrupted night's sleep. Also, almost all tube users who use tubes did say that they had physical discomfort because of their tube.
One of the most surprising findings was that nearly half received zero financial assistance from the government at all. This is a clearly identifiable gap. Many of our users spend over $200 on supplies, and some even more than $500 a month on supplies directly related to tube feeding. This financial pressure that we identified had a strong link to the reduced social participation and limitations at the workplace. So this is a huge gap that we've identified that we need to address urgently.
Thank you very much for listening to the presentation this far, looking over the results for our health-related quality of life study. When we step back and look at the full picture of this study, what becomes abundantly clear is that tube feeding affects more than just nutrition. It shapes almost every dimension of daily life for individuals who either rely on a tube or for those families who support them. What we see is a complex interplay between physical challenges, emotional strain, social participation, financial burden, and the broader systems that are meant to support these individuals. Adults in particular face significant barriers because they're most likely to withdraw from social activities, from friendships, from going out to eat, to hanging out, to going to concerts, to just enjoying that social aspect of life. And they seem more likely to hide their feeding tubes from their families, from their friends, and their work. Adults are also facing more anxiety, depression, and concerns about their long-term health. Many describe missing that simple act of chewing or of sharing a meal with friends and family, and that's carrying really some enormous social and emotional meaning coming out of this study. For women, in particular, these challenges are even amplified by body image concerns and lower levels of workplace support, which are concerning. Pediatric users, though, on the other hand, tend to experience better social acceptance and more supportive school environments. But this does come at a cost. Their carers shoulder a heavy emotional and social burden because carers of young children also reported feeling excluded from their own friends and having to limit their own social lives because of responsibilities associated with caring for someone who is tube fed. This really highlights that the impact of tube feeding extends beyond the patient and it affects the entire the entire family. Across all age groups, so pediatric, adult, female, and males, physical discomfort, disrupted sleep, and the practical demands of feeding schedules create daily challenges. Layered on top of this is a financial strain. Nearly half of the participants, as discussed, received no financial assistance at all, despite many spending hundreds of dollars each month on supplies. Financial stress was strongly linked to reduced social participation and those limitations at work, showing that economic factors can really confound the emotional and physical burden. Perhaps one of the most striking findings is that more than half of the participants did not really understand what tube feeding would involve before their tube was inserted. This lack of preparation was really associated with poor quality of life outcomes, really suggesting a clear opportunity for improvement in pre-insertion education and support for medical professionals. So all of this taken together, it shows that tube feeding is not just a medical intervention. It's a life-altering experience that requires a comprehensive but tailored support mechanism. Adults and female adults face really distinct challenges that need targeted responses. Carers, especially of pediatric users, are the invisible sufferers here as well. There needs to be recognition and resources available for them as well. Across the board, there is a pressing need for better financial assistance, better education, and greater social acceptance. Ultimately, to improve the quality of life for those that are tube fed, it means that we need to look beyond that tube itself, and we need to address some really important social, emotional, and structural factors that shape people's lives every day. Thank you for listening.